Gil, I want to start with with your reflection specifically on Rhode Island. You've been here, you've been to Providence before, you've been to this conference, but you talked about a lot of big picture items that are doable, and I'm curious, what would you say to the people in this room, and again, to the politicians who make a lot of decisions here, what's one thing or two things that when you walk out of the Rhode Island Convention Center that you immediately see when you see Rhode Island that could be improved, built upon, something like that?
Well, I think what I spoke was not only about the big picture, but the very small picture. I spoke about how the kids, 80% of the kids used to walk to school, now it's only 20% of the kids. Mostly it's because it's very dangerous arriving to school. So if we just put some pylons and we go to a school board and say, okay, even if you don't do all of your schools, let's do a pilot project with 2 schools. Let's put the pylons and let's not allow cars in front of the school. By the way, when the cars drop off kids in front of the school, the air in the classrooms and usually the administrative office by the drop-off is poisoned for over 2 hours. We are poisoning our own children just because we don't want to drop them off 2 or 3 blocks from the school. That is doable. That is very low-hanging fruit. When I was saying, let's go to the parks and let's do dancing with strangers, it's very local. We need to have activities. It's not only about doing walking path. We need to do the walking groups. Because we say, oh, but I see people walking. Yeah, we see the few that are walking. We don't see the many that are not. The number one health issue today in the U.S. is loneliness. Loneliness across all ages, especially people over 60. There are very, very few activities for people over 60, when it's the people that have the most amount of leisure time. So it's the people that should have the most amount of programs. I mean, the other day I was working in Denver and the head of park said, oh, but we do programs for adults and they don't register. I said, no, I'm not talking about adults. I'm talking about older adults. When you are 40, you sleep 8 hours, you commute 2 hours, that's 10. You work 8 hours, that's 18. You do cooking and chores another 2 hours. You only have 2 hours a day. You retire and now you have those 2 hours plus the 8 of work, plus the 8 of commuting, the 2 of commuting. So now you have 12, 14 hours to do, also not in the peak times. So what if, AARP is one of the sponsors, what if that became a huge issue that said, okay, in Rhode Island, we're going to have the best quality of life for people over 60. And everybody should care for people over 60. One is because it's 1/3 of our life. 2, because it's our parents, it's ourselves, and for the young people, it's their future self. They're lucky to. So how can we make that healthier and happier? So what I'm saying is, everything that I spoke is really down to earth. Is really, everything is doable. Nothing is about the money, and it's not a technical issue. And we can do it in our neighborhoods, in our schools, in our streets, in our parks, in all of this.
Diana, I'd love for you to reflect and kind of build upon what Gil was saying, and specifically you and I were talking, briefly before everything started, and about the idea of bringing sort of more diverse groups together to actually put some of the action steps, into play. And I'm curious, you spend a lot of time on research. But how do we get to a place where we can turn that research into real action with the broader public, not necessarily just the folks in this room, who are kind of on board, I think, generally speaking, with some of the major points that Gil made?
So as someone in public health, where the focus is thinking more about population, so how do we prevent disease? How do we promote healthier lifestyles? The important thing for us is, in terms of trying to do that, we realize that we can't only do research if we're thinking about population. Because the truth is, if you want to influence health, we have to think about economic policy. What kinds of benefits do we have for women, for example, in the workplace, in terms of time off if they decide to have children? That's really important. We know that school policy is important. Gil was talking about schools. If we want the kids to walk to school, do we have a safe routes to school program? So that's another group that we need to be able to work with. If we want to plant more trees, so some of the work that I do currently in Rhode Island is I work with schools across the state looking at the importance of the exposure to green space, whether that's trees or vegetation, and how that influences their mental health, how that influences sleep, and how that influences physical activity. So Of course, I'd like the kids to be outside more, but there are clear, we see clear inequities with respect to who has access to green space. So it's important to be able to work with, again, city government in terms of, well, where can we plant more trees? Where do we see where there's clearly a need? Because we know that trees influence heat, the temperature, some of the things that Gil talked about. The other thing is that if you have more green space, that also influences your property value. So some of the work that I do now with groups here in Rhode Island, we have a community advisory board. So we do the research, right? But it's also important that we're working with people that are actually in the community every day. So we work with Youth in Action, where this is an organization that, promotes leadership for youth and for them to think about how can they make an impact. We work with the Rhode Island Healthy School Coalition. We work with the Providence Neighborhood Planting Program. We work with Groundwork Rhode Island. So all of those groups are important because if we want to have impact on the children that we work with, we have to think about planting the trees, we have to think about the school policies, and we also have to think about how do we empower youth to also play a role with respect to improving their environments as well.
Yeah, I'm remembering very well now, seemingly a fairly long time ago, it would have been 2014, but I remember being a reporter at Channel 12, and there was lots of talk around providing more bus passes to high school students, and students asked us to take the walk with them from someone's house to their school, and I remember it being the push was to get it to 2 miles. Anyone living outside of 2 miles would get a bus pass. But we walked 3.5, probably 4 miles from kind of the Mount Pleasant, sort of that area, or the North End, over to Classical, and that walk was unsustainable. And any time in the winter, any time just having to walk past very fast cars, to your point, right? We're talking about 20-mile-an-hour limit. We're talking 50 miles an hour cars going by kids, right? And so I think it's so important to figure out, that conversation around how we can improve, whether it's neighborhood schools, which is a different conversation, but it's wrapped up in the same thing, so I appreciate that. Dr. Rodriguez, I was thinking about you as Gil was talking about the cities having the healthiest people and then the unhealthiest people, and the combination of that. And I know you work so hard on educating people, and obviously in your life just around actually treating people and helping people. But I'd love for you to reflect a little bit on what Gil was saying there about how do we build that kind of sustainable city that has the great bike lanes and is walkable, while also, though, thinking about our kind of neediest folks who whether it's do they need better, whether it's RIPTA, things like that. But I'm curious about how we balance sort of that the healthiest and the unhealthiest, and how we make sure our city is sustainable for everybody.
Thank you, and Gil, fantastic talk. Thank you for being in Rhode Island. The COVID pandemic was a real eye-opening experience. I was asked by the health department to go to the 2 places where the pandemic began. A meatpacking plant in Burrillville and a fish processing plant in Quonset. And why did they ask me? Because 99% of the workers speak Spanish. And that's where the first clusters of infection happen. So was the same thing happening in the town of Quonset or in the town of Burrillville? No, because all these workers in these facilities travel every day 2 hours of their day, going back and forth to the urban core. And where was the highest concentration of the infection? In Central Falls, where these workers live. So at some point, not at some point, this is an issue of equity in terms of where the investments have to be made. Because necessarily, the people, the workers that are in the worst shape, living in the cities and having the worst outcomes in terms of public health, in terms of maternal health, in terms of infection, is where the investments need to be really reinforced. And unfortunately, here in Rhode Island, we have this animosity between the cities of, if you give too much, to one, we need to give, more to the other. And I'm very proud that the health department, when the pandemic began, decided to go against the grain of the entire country and begin vaccinating the people of Central Falls, because the statistics are there, that this is where, things happen, bad things happen, where people are living 20,000 per square mile, one of the most densely populated, in the country. So, this idea of rebuilding cities, there are cities that need more rebuilding than others. And I think those issues of equity is what we have to have a shared vision, that it is in the best interest of Rhode Island to make sure that everyone has this access to a healthy living. By 2030, half of the new entrants to the workforce in Rhode Island are going to be people of color, are going to be the people that live in Providence, that live in Pawtucket, that live in Central Falls. And the people in East Greenwich and Barrington, everyone should be concerned about the health of these cities, because this is where, the state is going to move forward or not.
David, I asked you, it's very uncomfortable to call you David, I always say this, but Mayor, Congressman, Director. I deliberately went to you last because I wanted you to listen to these guys, but I also want you to recognizing that you're the former mayor of this city, and obviously you served in Congress, but you have been a part. I was thinking about what Gil was talking about with plans on plans on plans, and you also are very, very familiar with that term, cave people, citizens against virtually everything. I will say, and I said this in my kind of opening remarks before about wishing more politicians were here and hoping they get the presentation. One of the things I do worry about as a journalist here, and I've seen it for many years, is there are cave people, and then I think there are pals. Politicians allergic to losing. And I think the very big concern from folks is, boy, if I rip up that bike lane, are people going to be mad at me? If I put in that bike lane, are people going to be mad at me? The housing conversation. And so I'd love you to put your mayoral hat on and tell us how you get these things done. I was thinking about Oakland getting slow streets in essentially 24 hours or a short period of time. I've never seen that happen, maybe with the exception of the COVID response to some degree. But I've never seen that happen in my years covering Rhode Island. And so can you talk about sort of the difficulty in getting things done, but then maybe offer a reflection on maybe a time where you have gotten something done very quickly that has lasted?
Yeah. First of all, thank you for the presentation, and I too love that cave where we're going to use that. But I think part of it is, I remember one of the most valuable experiences I had when I was mayor was going to something called the Mayor's Design Institute. It was started by Mayor Riley in Charleston, and it was really designed to help mayors think about city design. Most mayors don't have a design background, they don't have an architectural background, they don't have a city planning background. A lot of them are lawyers, business people, so they come to a job where they're basically the chief designer of the city with no background at all in city design. And it's a 3-day kind of training session. I remember coming back, Tom Jello will remember it too, because I basically said, bring me now every single plan I've approved, because I want to look at it in a completely different way about the relationship between the street and the height and all these things. So I think part of what I hope is a presentation like this, if it were seen by every mayor, every legislator, these are good people who have good intentions, but don't necessarily see cities and city design in the same way Gil does, having studied it all over the world. And I think every elected official wants the place that they represent to be better and healthier and more vibrant, but don't always have all the tools and understanding of how to achieve that. We have great champions like June Speakman, people who are deeply steeped in this work, but I do think sharing with policymakers this kind of presentation will really change the conversation. And I think people want the end result, and they often see some of the easy things we could do to achieve there as actually impediments. And they're not impediments. I think politically, when people see how popular the end result is. You don't have to be worried about a political consequence of that because it's wildly popular. In every one of those examples, people loved the result, even if it was a bumpy conversation along the way. So I think that's the sell we have to make to people who you call pals, is like, you're going to be wildly popular at the end of this because the result is going to be something everyone wants: a healthier, more vibrant, more livable, more joyful city.
It's the middle that's messy. It's
That's
getting
right.
there that's the messy part, right?
That's right.
On kind of specific issues, and I'm conscious of everybody's time. I know everybody wants to network and talk to people, so I want to just kind of go around, maybe I ask you each maybe one more question, and I'll float this to anybody. But when I'm thinking about the importance of public transit, I think that there's this, and I have a Save RIPTA T-shirt that Liza gave to me, and I'm proud to wear it because I support RIPTA tremendously and think we should invest more. The strange thing is, something Gil mentioned in his presentation was the conversation is always, not enough people use it, right? It always starts with that, and then there's this, if you build it, they will come sort of conversation. But for any of you, again, having been around a while, it doesn't feel like there is real urgency to invest in our public transit, other than the once in a while we get I'll give a great example. The R line I think is great. I think we've done a nice job, connecting Broad Street to North Main Street, and generally speaking that has worked. But why haven't we been able to really get buy-in for RIPTA, and particularly outside of kind of the easy places to do transit, meaning Providence? And I'll leave that open to all three of you. Mayor.
No, it has always struck me, even when I served in the General Assembly, it struck me that we have had not enough champions for public transportation. Even when issues come up, it was always there was going to be a cut in service, and people sort of organized around stopping that. But I feel like in our state, we've never, GrowSmart's a great example of who's been a great champion, and obviously a number of advocacy groups. But it feels like because Gil's thesis has been proven here, when it's frequent enough, when it's quick enough, people use it. And it's a proposition that has proven true in Rhode Island as well as every place in the world. So I don't know the answer, but what I do know is that we are never going to solve, in my view, the challenge of creating great places and great cities without a serious investment in public transit. Like, it's just not going to happen. It remains the single biggest obstacle of connecting people to good quality jobs, their ability to get there. I mean, it's a huge problem, but we just have to make this transformation from focusing on motor vehicles. I was the guy who tried desperately for the streetcars. It would have changed the city. And we just never could get buy-in from a variety of places. But there is no reason we shouldn't have the best public transit system in the country. We're a compact state. It ought to be here, and I just think we have to just make a decision. As Gil said, it's not about money. We just have to make a decision to make it happen, and we can do it.
Money should follow the vision, not vision following the money. And unfortunately, that's what we have in Rhode Island, where we have a long-term vision, but a one-year budget. And it becomes a constant fight every year for pennies for this or pennies for that other thing, when in reality, we should be following the vision. And the reason I spoke about the workers of the packing plants is because they're spending 2 to 3 hours a day in a minibus or in a car. So even if you build a park, they're not going to have time to play in the park. So it becomes a self-fulfilling prophecy that if you are a low-income worker, a blue-collar worker, you're not going to have the time because you're spending your time commuting. So this is something that we have to really have a vision. Like you said, number one, we have to follow the vision, and the money should follow the vision, not the other way around.
Yeah, and one thing I think I would add to that, I'm curious what you guys think, is just what tends to happen, I feel like, is we start off with, as David said, I have no doubt that the vast majority of our elected officials and our policymakers really want to do the right thing. It's generally speaking, there aren't that many of you guys that are bad people. But I feel like the barriers that come up, and then to your point, we get a big picture idea, right? We're gonna move the RIPTA bus hub in Kennedy Plaza. But then, we're still waiting for the actual plan 10 years after we pass a bond to actually do it. And so, for folks in this room and I think elsewhere, to David's point, the conversation shouldn't just be when it's crisis time, right? When it's budget cuts, RIPTA, when it's how are we going to do this? It should come. That advocacy needs to be sustained and constant to actually get stuff done. Yes, please.
I think that the issue of public transit, my perception is that in Rhode Island is lack of equity. Because only the low-income people are using it. And the upper income don't care about how low-income people are moving around. It's that simple. If we had more higher income people using public transit, then public transit would be much better. I mean, I have gone by the place where you have now the public transit station here in Providence. It's dirty, it's smelly, it feels dangerous. So people don't wanna use that public transit. So only it has become the last resource. And then when it's the last resource, then the upper income couldn't care less because they are not using it, and they have not even in their wildest mind they're thinking. So I do think that I totally agree that people need to realize that the low-income people, you need to provide better quality of life, and part of because otherwise it becomes like a cancer that will spread out all over the state. So we really need to take care. That has to be one of our top priorities in any community, is how to take care of the most vulnerable, everyone that is poor, everyone with disabilities, the visible minorities, ethnic minorities. So I think that if public transit became, and with regards to the streetcars, they look cute, but they're very expensive and they don't move that many people. You could move as many people or more in buses and do it immediately. We have a lot of streetcars in Toronto, and the mayors have been building streetcars. What happens when a streetcar breaks down? The whole line is out. When a bus breaks down, the others, they just go around it. So if money is not the issue, do streetcars, do trains, do subways. But more than anything, you need to do citywide or statewide networks. And to do networks, you might not have the money. So it's not just about doing 5 miles of streetcar. If with the same money, you could do 50 miles of buses with dedicated lanes. So I think this is an issue of equity. And also, when you ask me about the local, the dual things, I mentioned a few examples. At the state level, I think it would be doing something like Oregon. I think Rhode Island would be transformative if the state approved a law similar to Oregon, that any city above 20,000 people, it should be mandatory to allow as of right to have ADUs, or for people to subdivide their homes in 2, 3, 4 units. That would be transformative, and I think that most of the people would like it. And finally, some decisions are not easy, some decisions are not popular. That's fine, but it's very important that when people are mayors or governors or councilors or commissioners, directors, whatever, it's important to have people that see the role. They don't want to be mayors or they don't want to be governors. They want to do as mayor. They see being mayor as a means too. And yeah, there are some decisions that might be very controversial that some people might not like. Okay, that's life. Then you might not be reelected. Others, they might, like you mentioned, the mayor of Paris. The mayor of Paris is doing now bike lanes all over Paris, and she was just reelected by an overwhelming majority. Mayor Livingston in London was doing the same, and he was not reelected because people didn't like it. But this cannot be a contest of popularity. This is not, we're not electing Miss America. We are creating a city. I mean, and all of Rhode Island, God was so generous with you. You have beautiful waterfronts. You have magnificent universities. You have all of the bones to be as good as any community in the world. Not any community in the US, any community in the world. But you gotta be bold. and you gotta be ambitious. And you need to really be committed to be the healthiest and happiest for all ages and all abilities, and then move in that direction.
Well, I just wanted to end on a more hopeful note. I'm actually from Houston, where, 20 parking lots per person? Was it 20, or was it, I forget what the number was. So I think that Rhode Island can be very excited that certainly is not 20, and it's something that's being discussed in terms of public transportation. In Houston, I think also thinking about what's going on locally and what's important to people. And in Houston, it's very important in terms of how big our cars are, unfortunately. So we're not even having this conversation. So I think Rhode Island should just be happy that this is even something that's being discussed, because in Houston, it is not going to work, at least not right now.
Yeah, you guys are very proud of your no zoning.
Very proud, yes, very proud. It's really about how big your car is.
No, but it's not only hopeful. I don't want to leave a message that I'm not hopeful. I'm totally hopeful. Accepted the invitation because I think that, and yesterday, thank you very much, I was invited to speak with the students of public health at Brown University and with the students also of design at the Rhode Island School of Design. And I said, why do I love speaking with students? Because I see too many of them that are hopeless. And I said, look, this is not about the money, it's not a technical issue. Shake up, move from hopeless to hopeful, because there are so many things that could be done. Every single action that I showed is doable, and doable in the short term. It's not sending people to Mars. It's completely doable. So it's very, very hopeful, and more in Rhode Island. You have all of the assets to really be absolutely amazing. But also you need to realize that you are very good, but you are far from great. When you have these issues of equity, when you have these problems of public transit, when you have issues of public health, you are not there yet. You are not there yet, so you need to be honest in your self-evaluation.
Good, but far from great. I love that. We should wrap that up. Once again, thank you to this wonderful panel. Thank you, Gil, for being here. I think you guys are going to stick around for at least a little while to network. Once again, I'm Dan McGowan, a columnist for the Boston Globe here in Rhode Island. Our office is across from a beautiful green space. We're on Dyer Street in the CIC building. A couple of, a 4-minute walk from the bike lane that's about to be ripped up. So we're a little bit concerned. But please come visit us. Thank you to this panel. And thank you, Scott, for hosting us all.
Dan, thank you, and the panel for a great...